And let's start off by talking about the vaccine shortage, because this afternoon Joy News is learning that more funding will be made available through the World Health Organization for Ghana to procure more vaccines to shore up its child immunization program. Over the last few days, the country has been receiving some supplies from neighboring countries as a stopgap measure to deal with the vaccine shortage that has hit the country. In the last few days, health experts have reported of cases of measles in parts of the northern region, but the Volta region is the latest to join that fray, raising concerns of a possible health risk and impact on the entire system. Days ago, the sector minister, Kweku Agyeman, addressed the press, indicating that some funding was made available to UNICEF to procure more vaccines. He assures that the vaccines will arrive in the next few weeks to deal with the shortage.
Some vaccine shortages in the country since the last quarter of 2022. The vaccines in short supply are BCG, measles, rubella, and oral polio vaccine, OPV. This shortage is nationwide. The recent shortage in vaccines for measles, as regrettably as it is symptomatic of the steady global decline in measles vaccination since the beginning of the COVID-19 pandemic. And permit me to quote from a WHO recent publication on the subject that puts the challenge we are dealing with into perspective. And I will quote: measles vaccination coverage has steadily declined since the beginning of the COVID-19 pandemic. In 2021, a record high of nearly 40 million children missed a measles vaccine dose. 25 million children missed their first dose, and an additional 14.7 million children missed their second dose. A joint publication by the World Health Organization and the United States Centers for Disease Control and Prevention reports. This decline is a significant setback in global progress towards achieving and maintaining measles elimination, and leaves millions of children susceptible to infection. And Ghana's Minister of Health has been making efforts to ensure we secure adequate stocks of vaccines despite this global challenge. We have made all necessary efforts to ensure that despite these challenges, we secure adequate stocks within the next few weeks. It is important to correct the erroneous impression that there have been deaths from measles in Ghana recently. For the avoidance of doubt, there have been no deaths from the recently recorded spike in measles cases. Indeed, there have been no deaths since 2003 in our country, though we have recorded cases annually. Finally, despite the challenge, Ghana's immunization coverage remains among the best in the world, and in 2021, we recorded 95% coverage. Working with UNICEF, we are fast-tracking the processes, and it is expected that vaccines will be supplied in the next few weeks, all things being equal. The Minister of Health, ladies and gentlemen, will ensure that we stay on track with the immunization record and quickly overcome these bottlenecks.
Well, from John News sources, part of the challenge confronting the country was the donor support through the Vaccine Alliance of Gavi, which was almost winding up this year, a reason for which our country was not able to access some fundings to complete the procurement processes for the essential vaccines. But now John News is learning that would no longer be a challenge, as the World Health Organization is indicating that an agreement has been reached for an extension of that funding source. I've been speaking exclusively with the Deputy Director General for the World Health Organization, Dr. Ansu Abanaji, who explains to us that issue will be dealt with. He, however, wants the government of Ghana to increase and prioritize matters relating to child immunization.
So what has happened during the pandemic is that many of the companies that produced vaccines had to shift some of their production lines for routine immunization towards production for COVID vaccine. And that has, let's say, from 2021, let's say, when the vaccine was started to be manufactured, has of course shifted, let's say, the global availability of some of the vaccines. Of course, we are coming out of that situation now, and so it is important that countries reinvest in accelerating the immunization towards immunization coverage. WHO has been working, and I think around 20 countries have been identified as priority countries to look at bringing immunization coverage back up to where we were before the pandemic. And this, of course, links very much to what I highlighted around the increased number of children from 19 to 25 million by 2020 that didn't have either a single or not all of their doses of immunization. So I know that the Ministry of Health in Ghana has made arrangements, and I think vaccines are coming into the country to allow to recapture, let's say, some of the losses in immunization coverage.
And for instance, some of the multilateral platforms available to us that are supposed to extend help to us through, for instance, Gavi. In the context of Ghana, for instance, we understand that that help will no longer be available for us in the coming years through the grants and support schemes that we get. So how do we approach some of these issues? Because the potential that it may affect the universal health coverage will definitely come up.
So I think in relation to Gavi, there has been an extension for Ghana to still benefit from the support from Gavi. And what Gavi, of course, provides is that it has ensured that vaccines are available at a much lower cost for low-income countries in order for them to be able to introduce it. And this is a huge advancement in equity, I think, because every child globally should have access to the same vaccines in order to protect, let's say, itself from him or herself from life-saving or diseases, let's say. So this has been a tremendous achievement from a global public health perspective. Now, Ghana indeed needs to look at how to finance, let's say, 100% of their vaccines after a couple of years. The Gavi support is still going on. But of course, Ghana has made tremendous progress because the way that Gavi works is not that you benefit from vaccines up to, let's say, 2023 or 2024, and then you pay 100% of the vaccines. What happens is that you slowly start co-financing the vaccines. So Ghana actually already pays for most of the share of the vaccines that are coming through Gavi to the country. So it's going to be a little additional investment that the government needs to make, because Ghana has been one of the front runners, let's say, in benefiting from the Gavi provided schemes. So the immunization program here has been very strong. Ghana introduced many of these vaccines already in 2005, 6, 7, 8, and has been co-financing those over the last years. So I think there will still be a challenge for Ghana, but it's going to be a small additional cost to what Ghana has already invested in the immunization program.
So indeed, there will be challenges, but how do we deal with that, and how do we show up our child immunization program? I want to bring in now Dr. John Appiah, who's the outgoing president of the Pediatric Society of Ghana. Thank you, sir, for your time here on the Pulse on the Joy News channel. So, of course, we're still recording some cases down south. Initially, the outbreak was up north. First of all, what do you make of this assurance coming through from the World Health Organization that funding will be made available?
Let me first thank you for having me and then hosting on behalf of Pediatric Society. I would like to express our sincere gratitude and joy to the news that we have heard, because all we're fighting for, or all we're asking for, is a piece of the cake for children. And that piece of the cake is to ensure that their health is secure. And this is extremely good news. And you remember when the minister actually was in Parliament, he actually requested or appeal for all of us to help advocate for support for Ghana. And we're at a point where all of us need to appreciate what is going on. And this is where we all need to be. All of us will have to be on the ground, join the ministry, join the minister, and ensure that wherever we can make appeals, wherever we can advocate for support for ensuring that vaccines are made available for children, we all go in there and we speak one language to ensure that children in Ghana will not be left behind. Yes, we know that there have been outbreaks. There was an initial outbreak which was reported from the northern region, but we know that it was not only the northern region. We're having some cases, but the problem in other regions like Ashanti, and then now we've also mentioned the Volta region from, I think, the last few days, is the fact that we are unable, news from our colleagues from the field is that we are just unable to confirm most of these cases. And this is where there's another challenge. In fact, it's important that we confirm these cases. The other thing is that with the outbreaks, we are going to continue to see these outbreaks. And we have also, in the statements that Pediatric Society have issued, we have appealed to government and also our developmental partners to support us with diagnostic equipment, help us track and trace the cases so that we can identify them early, institute infection prevention measures both at home and then also in hospitals, just like we did with COVID, to be able to arrest the situation and also care for those who are at risk. So these are some of the things that the society is actually focusing on.
Indeed, and all of this would have been averted if we had the vaccines in place. But speaking about Gavi itself, the Vaccine Alliance, how much of a big deal is it, talking about the immense contribution they play in our child immunization program? What do we stand to gain from that donor support that we're almost missing out on this year?
Yeah, so I guess as the minister and the deputy director general of WHO also highlighted, the fact that we're meeting headwinds, and these headwinds were the fact that production of vaccines were actually going down generally in the world as a result of COVID. Companies shifting their attention to address the pandemic, and that's normal. And secondly, also, Ghana's economy, actually, we've suffered in recent time. And we all know the exchange rate and then the challenges we have. So definitely that was going to affect the vaccines. But I think we should have also made plans far ahead in trying to address that. So yes, we don't want to focus on where the challenges are. We know the challenges. So moving forward, what can we do? And this is where it's important that all our partners like Gavi continue to provide the support so Ghana can recover fully from the economic shock and also the pandemic situation of vaccine production. We can recover from that situation. But again, our position again is to make sure that the vaccines are here and everything we can do to ensure that we get the vaccines in terms of advocacy, in terms of ensuring that families bring their kids out for vaccination, and also in terms of addressing the outbreaks. Those are our focus. And this is where we don't want to lose sight of our mandate.
Just for being fixated on the issue of the vaccine funding, but what's the mechanism to it? There's the issue about the cost sharing, which the World Health Organization was referring to. But what's required from the Ghanaian side?
It's just like the Deputy Director General actually highlighted. These are staggered. They will not withdraw the funding source suddenly. And they look at our strength, they look at our budget and our ability to pay. And as our economy gets strong, and I'm sure that there are other factors that they take into consideration. So looking at all these factors, that's when they negotiate, and I'm sure Ghana government also has the opportunity to negotiate Gavi. They sit down yearly, talk about what we can support and what we cannot support. So they sort of come in with support where we have shortcomings. But eventually, as he said, we need to work towards that. And all of us, and I appeal to Parliament, for instance, to be able to provide the needed support in terms of providing funding. We have actually also appealed that if it's possible, and we think it's possible, that the Parliament and all others should look into ensuring that if the money is coming from a reliable source like the Consolidated Fund, we have made that appeal. And in that case, we know that it's going to be assured. We know the challenges NHIS releasing funding being released to NHIS, and subsequently NHIS also releasing the funds to government. But I'm sure there are other mechanisms that indeed the government, I'm sure, will look at how to resolve these issues. And they are the experts in these areas to be able to handle the procurement and then the finance.
And I must state that conversation with the Deputy DG of the World Health Organization, there's another leg to that conversation which we haven't put out here, the portion about the calls for a targeted immunization for persons who may have missed that window at the time we're experiencing the shortage. The advocacy from the World Health Organization is that we go back to carry out that exercise and to protect that population. How do we approach that? Because that must be a difficult task.
Yeah, I guess Ghana has done well. Let's take a step back and look at what we have done with vaccination, immunization program. In fact, the managers of our immunization program, they have really been excellent. They have done pretty good. But for the fact that we did not have the vaccines in the system, we will not be sitting here having problems. They have done catch-up, if I can use that terminology, programs before, like immunization days where government put resources into it and then provide vaccine, and then across the country, we go to homes to vaccinate, and then all areas to find kids and vaccinate them. These are things that we have done it before, and then I know the EPI program is excellent. I mean, we are doing excellent. So once this has come up, and they have also, Ghana Health Service actually have highlighted the fact that they are going to do this. So we Pediatric Society have the assurance, I mean, we have faith in the system, and that once we provide the resources needed for this to be done, we know that the catch-up, we are going to catch up. It will take a little bit of time. We need to understand that we need to provide them with all the support that they need to go out and then do this. And as you can see from your own news items that you carried since the past few days when the vaccines came in, the public health nurses are available. They are ready to do it. They are all excited. Families are also excited hearing that the vaccines are in, thanking God for the vaccines being present in the country. So it's like we are all, the anxiety which has filled the country, especially parents and also Pediatric Society. We are relieved that we are beginning to see the vaccines coming in, and we hope that there will be more with the assurances given by the Minister and then also the Deputy Director General.
Since you're talking about what's arriving, there's a need to probe that, because the concern is that we're getting that from neighboring countries, and that's as part of the stopgap measure. How much time do we have?
Yes, that's a stopgap measure. I mean, you heard the deputy DG actually talking about the difficulty in getting this immediately, even if the funding is available. And I think it's a usual practice that if your neighbor's house is on fire, you help douse the fire, because otherwise, if you don't do that, it can spread to your house. And basically, the fact that our colleagues, the public health, actually also put out a message encouraging government to source from the sub-region those who have stock that they can spare. Okay, they should provide to us, and eventually we restore their backup for them. So these are backups, and I think it's in the right direction. As I said, Pediatric Society's focus is to ensure that we have vaccine in country, and we are hoping that by the time the ones we have in the system begin to run out, we find vaccines from any other source. Okay, they are all good vaccines as long as it's from a reliable source and can be used to immunize our children. That is what we are focused on looking at.
And I just want to take your thoughts on the science of it. Initially, when the outbreak started, it was somewhere up north. Are we able to explain what's happening down south? Because they were not in the picture initially.
Yeah, so several factors must have contributed towards that. So the vaccines are not available nationwide, but I'm sure there are places where they were hard hit, they were the hardest hit. There are others with places that had some and they actually continue to immunize. That's one factor. There's also environmental factors like the weather. This is measles is airborne disease, meaning that we pick it up from the air. So anyone who has the infection and begins to shed it, it's easier to spread it during the dry season where the air is light and carry the virus quite far, as you know. So environmental factors and also lack of immunization and infection prevention, all these things, I think we let our guard down. The other thing I think we also have not focused on is breastfeeding. You know, breastfeeding can give some passive immunization. We have a bit of low breastfeeding practices in Ghana. That's where, in terms of the programs that we are trying to run to bring down the sustainable under 5 mortalities, we know that this is where we are weak. We are weak in ensuring that babies are given breast milk. And this is the nutritious, we're talking about nutrition, helping ensure their nutrition. So several factors actually contribute towards the spread of the disease from different parts of the country to other parts of the country. So as I said, and sometimes also sensitization. Once you sensitize, people might not be thinking about that because measles seems to have been one of the last diseases that we think about if a patient presents with you with a runny nose, cough, and then also skin rash. There are other diseases that can present that way, but in recent past, measles have not been that common. But it could also be that we have measles around, but people have not been sensitized. But since the sensitization, probably we are going to see a bit more, okay, that can also contribute that a bit more of the numbers. So at this point in time, we need to stabilize the system before we start panicking again. We know this is happening. We understand what is going on. We are putting things, interventions in place to ensure that we get ahead of the challenge and then to arrest it. So talking about it's very important that we also focus, just like, again, let me bring us back to COVID time, just like we did for COVID. Let's look for those who have the infection. Let's implement IPC, infection prevention measures, so that the disease does not spread to others, and also ensuring that we get a message across to parents that one of the things they can do, even if they've not vaccinated their kids, is to breastfeed their kids, especially those less than 6 months of age.
Okay, so you mean to say that you support the calls by the World Health Organization that we do a targeted, if I may call it, a revaccination exercise? That may be costly and a difficult task. You agree?
Yes, it may be costly, but the cost of not doing it is much more expensive than investing in that. I mean, we are there. This is what we are doing. We are at a point where we have to do. You have to do it. And if you have to do, you have to do it. And if you want to stop the measles epidemic or spread of measles across the country, this is what we need to do. And again, let me highlight again that yes, the Deputy Director General has reinforced what Ghana Health Service is planning to do. So once they are planning to do, there's reinforcement. So let's support and encourage Ghana Health Service to go all out and ensure that every child who missed the immunization actually gets the vaccine.
And Doc, your message to lactating mothers out there?
My message to lactating mothers is that breast milk is the best for our children. It's a full meal for the child. there's variations for breakfast, variations for snack, variations for snack, lunch, variations for dinner. It's full of water. Children less than 6 months old do not need any other source of nutrition, any other source of water except breast milk. And if we are able to do this for them up to the age of 6 months, we'll cut down malnutrition, we cut down spread of other infections that are worse, or malnutrition makes it worse, like measles, so that most of our kids will survive if they are even infected. And remember that breast milk also contains what we call antibodies. The mother, because they are exposed or they haven't been vaccinated before, will have antibodies or soldiers against the measles virus. So that is the last, that's our last line of defense if we don't have the vaccine. So my last word is that let's continue to give babies feed them exclusively with breast milk till they are 6 months old, and then when they need beyond 6 months old, we follow up with a child welfare clinic so that they teach us and guide us in what winning food that we can give to the kids. So that's my final way to lactating mothers.
Right. Dr. John Appiah, thank you for joining us here on The Pulse. I'm grateful, and we'll see you some other time. Thanks for joining us.